Welcome to Knowledge Valley for IAS, IFS, IPS. Today we are going to see a very interesting article of The Hindu which talks about the genuineness of the journals which are currently being presented or currently being posted in the various you can say journals or in the various reports. This is the key lesson that we learn. The key lesson is that it is a mistake to assume the scientific process as one divorced from influence of power, privilege, finance, and politics. So, the reports that we have, the journals that we have, the research that we have, it is many a times due to the influence of power, privilege, finance, and politics. So, let's see what has happened that we come to such a conclusion. A very good example in the current situation of COVID-19 was the example of the hydroxychloroquine medicine that you had, or the hydroxychloroquine tablet. Many researchers showed that this tablet was good to treat sick COVID-19 patients. But later what happened, and that is why India got a lot of orders for this tablet, that is hydroxychloroquine, and especially from United States. That is, Donald Trump was a strong or vocal supporter of hydroxychloroquine tablets. But then what happened in the Lancet journal, or you can say the New England Journal of Medicine, as well as in the Lancet journal, there was a question which was raised on this hydroxychloroquine tablet. The journal, that is New England Journal of Medicine, as well as the Lancet journal, both of them said that this hydroxychloroquine results into heart or the cardiovascular diseases. And that is why WHO had to stop the use of, or tell the countries not to use, hydroxychloroquine tablet due to the principle of do no harm. Do no harm principle means if there is no proper research done, studies done, and if the tablet is being used, it can be promoted, but if it is seen that it hurts if it has side effects, then it should be stopped or banned. So that is this principle of do no harm. So just remember, the New England Journal of Medicine, there was a data published, as well as the Lancet study which said that hydroxychloroquine can be related to the various or you can say it leads to various cardiovascular diseases. But there was a problem which happened. The Lancet study triggered a backlash from scientists who found problems with the methodology and, more importantly, the data set. Now, Lancet and the New England Journal of Medicine both had come to this conclusion after studying a data set, but there was a peer review done, that is, the other scientists did research on it, and they found that there was some issue in this data set. It emerged that the mortality attributed to the diseases in Australia did not match with the country's own estimates. So the data set was not matching with the estimates which the country provided. There was no way to tally patient records and hospitals they were sourced from, and there were problems with the statistics deployed and conclusions about the potential risk from the drug. So the database was not proper. It did not match with the Australian. They must have taken the Australian people's case as a case study, but it was not matching. The data was completely opaque, and it did not tally with the patient records and the hospital records. The bigger concern was that the data was supplied by, remember this, Surgisphere Corporation. So data was supplied by Surgisphere Corporation, which had a handful of employees with limited scientific expertise and claimed to have aggregated its number by compiling electronic health records in less than 2 months. Experienced clinical trial specialists said this was a labor intensive project or process. So you can't have some people who are not experts in this, you can't have them collecting the data and then you conclude by this data. Moreover, when aspersions about the data started to swirl, the company, citing client confidentiality, said it was unable to share its data source for independent assessment. Now, because of the Surgisphere becoming so opaque, because of the New England Journal for Medicine and Lancet Journal coming out of bringing the data which is not methodologically right, and they coming to a conclusion was not proper. So that is why the question is, can we trust these reports, can we trust these journals who have influence of power, privilege, finance and politics? This article talks about, could the rules and practices organizing healthcare around the world, could it have better suited this to this COVID-19 outbreak? What it means is, the pharma industry that we have, the pharmaceutical industry that we have, it has turned out to be so profit oriented. The system that we have is so corrupt, and a lot of issues are there in the health system. If we could have made the things better, would it be possible for us to handle the COVID-19 situation better? So this article is about that, and it focuses on research and development, and to create a fund called as Health Impact Fund. Now let's see what is this Health Impact Fund. Before that, let's see some data on research and development that we have. Or before that, let's see some data on the medicine industry that we have. Medicines are among humanity's greatest achievements. The global market for pharmaceuticals is worth 110 lakh crore annually. So remember this number, 110 lakh crore annually is the global market for medicines. 1.7% of the gross world product. 55% of this global pharmaceutical spending, that is the 60 lakh crore, is spent for brand name products which are typically under patent. So the patenting is very, very important, and once patenting is done, these pharma industries or the pharma companies sell their products at very high prices. So you have seen the data. Now what do commercial pharma companies do? They patent their products and they sell it at very high prices to earn a lot of profits. And remember, this patented products are for 20 years. So their patent is for 20 years. So remember, the medicines that they patent, it is for 20 years and it is done by WTO. Now what happens when they patent this tablets or medicines? It creates a monopoly, and they sell it at high prices. And when these products are sold, or when these medicines are sold at high prices, it is far away from the reach of the poor people who cannot afford them. So this is another issue. The patents are at high prices, but it is affecting the poor people who cannot afford them. In India, compared to USA, the patenting profits are much, the patented profits earn a lesser amount, because there is a price, there is a profit maximizing monopoly price is there. So there is a cap on these prices. In United States, 1,000-fold markups over production cost are there. So just remember, in USA the markup sometimes goes more than 1,000-fold, which is less in India, but still it is unaffordable to many of the citizens who can't even afford a square meal a day. Now what is one of the important factor which affects, or what is it that affects this high prices? So the first thing is research and development costs. So the research and development cost is very high, not only in India, all across the world. It's very high, and that is why what the companies do is, first they have to get their research and development cost, which is currently 14 lakh crore a year, and then they look at their profits. So what we can do is we can do some changes, or we can have a fund called as health impact fund and use it for research and development, and thus reduce the costs of the medicines that we have. What are the positive points of patenting? So when we talk about patenting, it has a few positive points. That is, it gives motivation to the scientist. It gives motivation to the innovators to innovate more, to work more. They get incentives. It also helps the people from copying these brands and selling it in the black market, or sell inferior products in the black market. So these are some of the benefits, but there are some concerns regarding the, or you can say, negative point of patenting. First is, innovators are motivated by the prospect of large profits. They only focus uh, on diseases, you can say, or issues, you can say, which are concerned with the rich. They will not, or they have neglected diseases which are suffered by mainly the poor. So some data we can check. The 20 WHO listed neglected tropical disease together affects 1 billion people, but attracts only 0.3% of pharmaceutical industry's research and development. Just see the number: 20 top tropical diseases affecting 1 billion, but only 0.35% of pharmaceutical industries research and development, and 0.12% of this R&D spending is devoted to TB and malaria, which kill 1.7 lakh people each year. So this is how we are neglecting the diseases which are affecting the poor. Secondly, large number of affluent or well insured patients are there, so they have got insurance, and that is why the hospitals or these medicine industry people, they charge more, thinking that since people have got insurance, so they can pay more, as the insurance companies are paying, and that is why the medicine prices are high. Third is, rewards for developing and providing pharmaceutical products are poorly correlated with therapeutic value. What do you mean by this? The products are not charged on the basis of the effect, they are charged on the basis of branding and marketing. So the medicines are like just another products which are sold in the market. So that is why there are these issues of pricing in the medicines, pricing of the medicines, and issues related with research and development. So what the article is saying, that to establish a health impact fund. Now this article is written by two very important people, that is Felicitas Holzer, researcher in Bioethics Center and Bioethics Network of WHO, and you have Thomas Poge, is Leitner Professor of Philosophy and International Affairs, founding director of Global Justice Program at Yale University. So these are the two people who are writing this article, and they are suggesting a health impact fund. Now what will the health impact fund do? Now health impact fund will take the top 10 medicines which are registered, and they will ask the medicines to be sold at a low prices, and the fund which is there, they will pay these companies for the low prices. Since the companies are selling it in low prices, they might be getting some losses. It will be made good by this health impact fund. On funding, the fund could start with as little as 20,000 crore per annum, and they can take 10 to 12 medicine, with one entering and one exiting in a typical year, and it would be for 10 years. Okay, so 10 to 12 medicines initially start with 20,000 crores, and per medicine will earn around 17,000 to 20,000 crores every means in an average for 10 years. Okay. Long-term funding for the funds will come from the willing governments. So from where we have the funds, it can be from the willing governments who want to contribute. Now this is going to be happening in the international level. So it will be from the willing governments who want to contribute. Secondly, how will the willing governments take the money? It can be from a tax, or it can be from a greenhouse emissions or speculative financial transactions, anything. So they can pick up a source of income and put the money in the health impact fund, so that they can motivate those researches or those medicines who are not in focus or which are affecting the poor. So another thing is, non-contributing rich countries could forego the benefits if the people don't want to, if the governments don't want to contribute. They will not get the benefits of this. So this will motivate the medicines. This will motivate the government to come and contribute and earn the money and reduce the medicine prices. The fund would get pharmaceutical firms interested in certain R&D projects that are unprofitable under the current regime. So this will motivate the pharmaceutical companies so that they can register themselves, do research and development in those areas which are normally not considered by them. The fund would make an important difference also by rewarding for health outcomes rather than sales. So as we had discussed, focus is mostly on sales, but now health outcomes can be focused on. So just remember, so on funding you must remember, for the funding will come from the willing government. It will be for 10 years and 10 medicines will be there, and the focus will be on health outcomes and research and development. Okay, so just remember these points. For achieving health gains with their product, innovators need new strategies. They need to deliberately or holistically know about their drugs can work in the context of or in synergy with other factors. So all these factors are needed. With the factors like even testing is important, not only medicines. We can mix this with testing and see to it that we holistically develop our medicinal infrastructure, our health infrastructure, rather than just focusing on the medicines. And we also need to focus on the tests. We also need to focus on the various laboratories which are in conducting the tests. So by having a synergy of all the sectors in the health industry, we can improve the health infrastructure, reduce the rates of the medicines, and get a better healthy life for the people. One of the important factors is issue of state risk. Participation of commercial pharmaceutical companies is very important in this research and development. But the commercial pharmaceutical companies are always skeptical because they are scared of the state. There is, in the WTO, there is a concept of what we say compulsory licensing. In the compulsory licensing, what it means is, if the medical or the medicines are important or they are life saving to the people, the country can give compulsory licenses to the other companies, and they can make the medicines regardless of the patents. So what happens due to this, those companies who have done research, who have done the hard work and they get the patents, they don't get the benefits of their hard work, and then it is given to the others. So the issue of state risk means the state interferes in the profits of the companies, which makes the companies skeptical, and then they don't focus on research and development. So health impact fund will save the company from these risks, and they can focus on innovation, and they can focus on doing good for the people. Another factor is, nowhere is this focus on results. As I just told you, it's all on sales. There is no focus on the results, which the health impact fund would encourage in the innovators. collaborating with national health system, international agencies, such a firm would seek to build a strong public health strategy around its product, because it needs money. It will be getting the money. And once in the 7 years, so the person they are writing the articles, they are saying, once if the company, when it reaches the 7 years out of the 10 years, means after 10 years it will be removed from the list. When it reaches 7 years, it can enjoy the world's goodwill, gratitude, and collect more rewards and payments, which, and also it can be given the charge of getting research done on some new medicines. Like for example, we could have, if we had this concept of health impact fund, the companies which are already doing well in the market, and which are going good with the research and development, could be given funds from health impact fund, and they could have got a medicine, or at least start the research and development for medicines related to COVID-19. So still, despite the roughness of such a model baseline, the fund would give innovators the right incentives. It would guide them to ask not ask the question on how is this product going to be effective in the concept of sales and profits, but rather how it is going to be helpful in developing an effective product and deploy it so as to reduce the overall disease burden as effectively as possible. So the pandemic should make us stop and think which of these two questions should be guiding our pharmaceutical innovation. Thank you for listening. Remember, the art and science of asking questions is the source of all knowledge.